We will talk about eye transplantation. Eye transplantation can be whole eye transplantation and partial eye transplantation. Whole eye transplantation is very difficult. It means you should transplant whole organ, eye. It's very difficult. Main limitation is that you should connect optical nerve and retina, which is very difficult technically and surgically, also very difficult. That's why eye transplantation is a challenge for medicine. But previous month in November we had successful first eye transplantation operation. It was 46-year-old military veteran, and he has facial injury, severe facial injury, and eye was successfully transplanted. But problem is that this person is not recovered, and his eyesight is not recovered because there is challenges of this connection, as we said, retina and optical nerve. This is optical nerve and this is retina, and connection between them is very difficult and challenging. And what we can say that in next 10 years with high probability it will be possible to connect them correctly and functionally, and it's highly likely that in next 10 years whole eye transplantation will be possible and will be routine surgery already, because today it's usually only studied and only on experimental level and not in clinical level. Second, there is partial eye transplantation, which means retinal transplantation and optic nerve transplantation, but they are still very challenging and difficult, and we can say that these transplantations also only on experimental level today, because there is many challenges and preclinical studies. So at least several years is required to implement such surgeries in daily medicine and in clinical medicine. But what we have corneal transplantation. What is cornea? Cornea is a lens-like structure, transparent structure, which is dome-shaped. And what is cornea's main function? Main function is to focus light towards retina, and we get light on the retina, and we will have image of environment at last. So cornea is lens-like structure here. This is cornea also. This is cornea transplant, you can see. And cornea transplantation is already well-established surgery. And what are main indications? Main indications of cornea transplantation is scarring due to infections or injury of cornea. If person has scarring this cornea importantly, then transplantation of cornea is important and its cure. Keratoconus is important disease also. During keratoconus we have thinner and bulged and thinner conus form cornea like this, and at this case transplantation also is indicated because person loses eyesight because of this disease. And Fox disease is another indication. It's degeneration of corneal endothelium, and it's also indication. So these three diseases are most common indications: scarring, keratoconus, and Fuchs disease, Fuchs dystrophy. Now here is questions that from where we get these donors cornea. We get it usually deceased donor, the person who already dead. Of course he or she pledged that he gives his or her cornea, and we get it from deceased person and then transplant it to the recipient. Success rate is 90%. So success rate of corneal transplantation is 90%. It means that the person will regain eyesight within 1 year with 90% probability. It's very successful. It's considered very successful transplantation surgery. And what is main problems and main limitation? First and important limitation is to find a compatible donor. It's very difficult. It's difficult to find such person. So it's first main limitation. Another limitation is increased risk of glaucoma. Glaucoma is another disease of eye and is complication of this transplantation. And rejection. Rejection is serious condition when our immune system fights against this new transplanted organ and tries to reject this organ, and this is problem. This is problem, and in 5% cases we have important rejection problem, and in 1 or 2% we have very severe rejection problem. What means severe? Severe means that you need to do something. You need to replace this transplanted cornea or remove it. So it happens in 1 to 2%, and you need immunosuppression therapy. And immunosuppression therapy should be aggressive, and immunosuppressive therapy has its complications and side effects also, and adverse effects. So if there is rejection, or if our body refuses to accept this new transplanted organ or cornea, we need immunosuppression. Immunosuppression may last for several months, may last for several years. It's really problem. Problem is because immunosuppression also increase risk of infection, kidney damage, diabetes. So immunosuppression is not safe procedure. So what we can say? We can say that whole eye transplantation is not possible yet, but within 10 years it will be very realistic, I think. Partial eye transplantation is possible, especially for cornea. For retina and optic nerve regeneration, it's still difficult and it's still challenging and only preclinical stage, so it requires time to implement such procedures, but we have successful corneal transplantation. So if we assess all these achievements in medicine, it's not big enough. We need more work on it, but in future I hope and I think that there will be really possible to transplant eye. Also there is artificial eye and idea of artificial eye, and I think it will be possible to implement this also. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.